From the beginning, InMotion has had an interest in hearing people's stories. For many in the Parkinson's world, these stories bring a shared sense of community, making the challenges that come with this diagnosis a bit less daunting. So, while our mad dashers were trekking the globe, our very own Les Levine, sports radio talk show host extraordinaire, was busy here at home with a segment we call Mad Dash Unabashed, PD Straight Talk. Les's first guest is Dr. Jay Alberts, who, as an avid cyclist himself, discovered the beneficial effects of fast-paced cycling in reducing motor symptoms in PD patients. Let's listen.
To the Mad Dash, that of course for Parkinson's disease, as well as our friends at InMotion. I'm Les Levine. Along with me today is Jay Alpers. And Jay, they said don't call you doctor, but I'm going to call you doctor anyway, because you're a PhD, but you're not a doctor, and you don't have Parkinson's. So how does this whole thing mesh together and make it work for you?
Well, let's first go back and revisit the doctor concept or component. So the real reason you shouldn't be calling me Dr. J is because my childhood hero was Julius Erving, and he was the original Dr. J, right? And so I'll tell you a side story there that, you know, when I was a little kid, I would see Dr. J and I'd be out practicing, and I would every night, it was the time when Sally Struthers was on TV, and she was saying, you know, trying to get support for the children. And every night I'd pray to God, I'd be like, God, if you make me like Dr. J, I will, you know, I'll donate all of my, well, maybe not all of my money, but some of my money to Sally Struthers. He realized I was lying and did not bless me with the ability to shoot or dunk a basketball like the true Dr. J. So that led me to scientific pursuits, and I had to get the PhD instead of in science instead of the PhD in basketball. But,
you know, over the years, I sometimes assume everybody is at the same sports level as I am as far as the timeline is concerned, and I just assume everybody knows who Dr. J is. But what I wind up suggesting to the young kids is go to Google or whatever you go into these days, look up Dr. J, Pistol Pete Maravich, guys like that, and they come back and their heads are spinning when they see these guys.
No, it's absolutely. My son, you know, that's where, you know, with the whole Last Dance, you know, we've been able to do, you know, some historic footage as well, and bringing him back to seeing, you know, Dr. J and George Gervin and all of those guys. And, you know, I keep telling him that, yeah, you know, Dr. J invented the dunk and Michael Jordan perfected it. But yeah.
But of course, LeBron would have blocked it, so it would have been fun.
Yeah, there you go, exactly.
And so how did you get involved in the Parkinson's movement, so to speak?
Yeah, so, you know, if I go back and just think about how I got involved in Parkinson's overall, you know, I was actually an undergraduate at Iowa State University, taking a physiology class, and we were talking about the basal ganglia. And my professor brought a Parkinson's patient in to the class to just talk about basal ganglia function and how, you know, Parkinson's affected that. And you know, he made a very interesting comment. He said, I know what I want to do with my hands, but I can't make them do it. And so for me, as a relatively unfocused undergraduate at that time, it really focused me, and it made me think, you know, how can I, you know, potentially help Parkinson's patients and simultaneously learn more about the brain in terms of its role in the control of movement and such. So that's really where it started. And then I went to graduate school in Arizona and studied with George Stelmach, who was a very well-known researcher at the time in Parkinson's. And it really just built from there. But the way I got involved in the exercise component was really, it was very serendipitous. So, you know, in 2003, I was at Georgia Tech and Emory. I was doing a lot of work with deep brain stimulation and, you know, trying to optimize stimulation patterns and such. And then, you know, we happened to ride a tandem bike across the state of Iowa with Kathy Frazier, who was a Parkinson's patient in Atlanta. And it was that experience that really, transformed my thinking of exercise and Parkinson's disease.
What were you thinking? What did you wind up thinking?
Yeah, so originally, at that time, you got to think about 2003, people weren't talking too much about exercise from the way we think about exercise now. And the reason we even went to Iowa, to do that bike ride on a tandem, it wasn't to, look at the effects of exercise on Parkinson's. Really, I'll bring us back to a very personal story. Is, there was a good friend of mine who, who I used to work for in the summers on his farm, who was diagnosed with Parkinson's disease. And, the provider, the physician told him that, in 3 years, you'll be here, 5 years, you'll be, struggling to walk, and probably 8 years, you'll be confined to a wheelchair. And, he heard that and he thought, well, this is sort of my lot in life and a death sentence of sorts. And, I talked to him and I said, that's not the way it is. There's an opportunity to do other things here. And so really Kathy and I in 2003, part of our goal was to go back to Iowa and to raise awareness for Parkinson's disease, and that this diagnosis is not a death sentence, but rather, you have to, try to battle it and fight it. And so we, again, went to Iowa and we're just trying to spread that message originally. And it was very serendipitous that Kathy, even that I was riding with Kathy.
What did you know about Parkinson's? When I was diagnosed with Parkinson's, I didn't know anything about it. I knew Michael J. Fox and Muhammad Ali and a couple of other people, but I really didn't have any knowledge at all of the disease. In fact, the doctor came in, I was being checked for a back problem. And the doctor saw me walk and he says, "How long have you had Parkinson's?" I said, "I don't." So they said, "Well, we need to check on some things, but 6 months down the road, we may find out that's what it is." And that's exactly what happened. So what did you know when you heard about this and connected it with your friend?
Yeah, so I knew from a scientific perspective, all about Parkinson's in terms of, certain the loss of dopamine neurons within the basal ganglia or substantia nigra, and how that affected the circuitry, and then also clearly all of the clinical symptoms and the motor and the cognitive symptoms as well. So I had already been studying it, and I knew about it, and I knew also that those patients who took a more active treatment in their or more active role in their treatment actually tended to do better based on our work at Emory and Georgia Tech. And I knew that there were surgical interventions, deep brain stimulation, palidotomy, et cetera, for patients who were a little later in the stage. But it was really, my friend being diagnosed in Iowa was probably the most personal aspect of it for me.
So is the reaction the same? I mean, you're not doing it clinically, I guess, but when people are told they have Parkinson's and what they're supposed to do, is generally the response the same?
Well, I think the response from the patient, or
yes,
yeah, I think for many people it is the same in terms of many people, especially those who maybe don't have a tremor. The response is probably a bit on the shocking side, right? Like your example, you thought you had a back problem, so that is probably very common when people are diagnosed, that they are a little bit surprised that this is Parkinson's, or not something else, right?
Yeah, there's some ugly choices out there. You're involved in pedaling for Parkinson's. This is a worldwide organization, right?
Yeah, we have pedaling for Parkinson's programs across, certainly across North America, and I think there's 3 in Italy. So I guess that those 3 sites make it worldwide.
What is the goal of it?
Yeah, so again, when we were in Iowa, we saw that well, first of all, when you're at Emory or Georgia Tech in Atlanta, and now at the Cleveland Clinic in Cleveland, what I realized is this is not reality, right? From a medical perspective, right? So in Cleveland, we have the clinic, we have UH, Metro, really world-class healthcare just at our fingertips. It's a bounty. In many other places, that doesn't exist. Many Parkinson's patients are managed by primary care providers who have a fantastic heart and intention, but as Parkinson's is a difficult disease to manage from either a medication perspective, deciding on deep brain stimulation, et cetera. So what our goal was with pedaling for Parkinson's was to bring exercise and known effective intervention to the masses. So we partnered with a number of YMCA programs or places across the United States and created a Pedaling for Parkinson's program that was based on our very early research study, in which we showed that cycling at a high rate or a high pedaling rate actually improved motor symptoms significantly. So I think right now we're at about 150 or so Pedaling for Parkinson's sites across the United States and Italy. And it's really, what I've seen in terms of visiting those sites is that, there's really two parts. There's the exercise component, which is huge in terms of getting people together to exercise and to exercise at a high intensity and a high pedaling rate that improves function. And there's also, very importantly, and I underestimated this, and this is the community, right? So now you have a group of individuals who are together and they're battling this disease together. And I think that community aspect is something that's critically important, and you see it at the InMotion folks. They've developed a community, and, Parkinson's can be a very isolating disease, whether it's the tremor and, people sometimes feel socially isolated with that tremor or other aspects of their disease. And this brings those folks together in a community. And I think it's a wonderful community spirit.
What has the COVID-19 done to this whole thing besides the obvious?
Yeah, well, I think it has, obviously, I think at one point, 98% of the YMCAs that we are in were closed. So that was tricky. But I think it's really, pushed us to figure out other ways to connect with patients. And it's also, stressed the importance of community and, embracing technology to try and keep that community together during, this sort of unprecedented time for us.
The InMotion has been terrific for so many local people here. When you look at it, do you say this is the ideal, this is what we should set up everywhere? Or is it, as you mentioned, it's tough to do because of the small amounts of care that is available?
Yeah, I think it actually, in those places where there is smaller amounts of care or, more care by primary care providers, I think it's even more important, right? Because, now with technology and with access, we can empower patients in those areas to take a much more active role in their treatment. So, that's the other thing about it. I think that's important from not only a community, but also an individual perspective. Parkinson's tries to rob someone of control, right? It robs you of, just like when I was an undergraduate, the guy knew what he wanted to do with his hands, but he couldn't do it. So the disease is trying to rob you of that control. And I think getting back in a community setting or with, things like InMotion activities, et cetera, that are real holistic, allows someone to regain part of that control again.
It's funny. I drove by an elementary school where I used to play softball 100 years ago. And I just got out and started walking around, reminiscing a little bit. And I went out around second base and I pretended I was taking the shortstop's role on a double play. And I couldn't quite do it like I did in the old days. So I said, I guess who's ever in charge gives you a certain amount of double plays you can make, and that's all he's going to let you do.
Yeah. Well, I think the great thing about it is that you're still trying to make double plays. And while those double plays may not look as pretty as they did when you were in elementary school, you're still trying to make them. And that's an important component.
But I could still hit in the double plays without any problem.
Well, you got to know your strengths.
Yeah, very good. Well, thank you so much. Best of luck with the Mad Dash coming up real soon. Dr. Jay Albert's with us today, and we appreciate it very much. Thanks so much on behalf of In Motion.
Absolutely. Great to be here. And thank you for all you do for In Motion as well.